All right, we're going to go ahead and get started. Hi, everyone. I'm Nicole Clement, and I'm one of the program specialists with the task team. Breakout sessions and plenary sessions are being recorded. If any of you are having technical difficulties, please utilize the chat feature and our staff will assist. Please use the chat feature if you have a question for a speaker, and Zoom closed captioning is enabled for this event. If this is an option you would like to utilize, click on the CC button on the bottom ribbon, then select live transcript, then show subtitles. If you are needing further instructions or assistance, please indicate this in a private message within the chat box, and I would be happy to assist you moving forward. Let's see. So welcome to this session, Value of Rural EMS. EMS leadership training and education has become an invaluable resource in our states and continues to be sought after and well received. Presenters today are going to share their ongoing initiatives to bring inspiring quality EMS leadership training and education to rural EMS professionals. The State Office of Rural Health in Michigan has been funding EMS leadership academies since 2005, and the Kentucky Office of Rural Health began offering EMS leadership courses in 2020. We're going to hear about the logistics and value of these unique EMS leadership programs, and this presentation will also provide insight into the approach that each office took and their return on investment. So our speakers are Andrea Abbas and Scott Helly. Andrea is the EMS Programs Manager for the Michigan State Office of Rural Health, EMS Innovation Coordinator for Michigan-based EMS agency, and the owner and author of the EMS Professional. With over 20 years of EMS industry experience in various leadership roles, including field training officer, supervisor, quality assurance and compliance manager, EMS director and programs management, Andrea is skilled in system management, training, education, administration, and project management. She has work experience in frontier, rural, suburban, and urban EMS systems. In addition to her leadership experience, she brings years of experience working in the ambulance and emergency department. Andrea holds her National Registry Paramedic License, Community Paramedic Certification, and Instructor Coordinator License, in addition to formal education and degrees. Andrea is an avid blogger, national speaker, podcaster, and consultant. Scott Helly is a rural project manager in the Kentucky Office of Rural Health, where he focuses on maintaining and fostering relationships with Kentucky's rural EMS services. He graduated from Lincoln Memorial University with a Bachelor of Business Administration. He also serves the office as an instructor in mental health first aid, CPR, and Stop the Bleed. He is a certified ambulance coder, a certified ambulance compliance officer, and a certified Kentucky EMT. He has more than 25 years of experience working in the pre-hospital EMS field in rural communities. So with all that said, I will turn it over to our speakers.
Good evening, or afternoon, I should probably say. Morning for some. Let me get my screen shared here. And we'll get going. So basically, we're going to talk a little bit about rural EMS leadership. My portion of this session is going to be on how Kentucky Office of Rural Health developed our program and why we kind of got involved with this. So just a little bit quick introduction about me. I'm an EMS person at heart. I've got management experience along with EMS experience through a variety of rural services throughout Kentucky. So just kind of explain a little bit about Kentucky Office of Rural Health, how we are formed and how we've kind of set up. We're part of the University of Kentucky Center of Excellency. When the state created the state office, UK was creating the Center of Excellency as well. So they just felt that it was best fit and kind of merged us together. So the Center of Excellency is the state office, designated State Office of Rural Health. So I want to just throw that in there real quick. So just to kind of get a little bit into how we got into EMS a little bit. Of course, everyone kind of knows the programs that we get involved with the Flex and the SHIP, as well as we work with the FQHCs and RHCs. So getting out into the communities and with dealing with these different partners, everything kept coming back to EMS. and how EMS is involved with the different aspects of it. So a few years before I got involved with the office, the state office started mingling a little bit in the EMS. I had an opportunity to bring me on board around 2019. So they wanted that EMS person to have some experience in EMS. So they brought me on board, and we started mingling a little bit more in the EMS, and started deciding that kind of figured out that we needed to focus on some training and different aspects. So prior to the pandemic, and early 2020, we did a big statewide EMS listening tour throughout the state. Some things that we noticed and captured from that was a lack of EMS leadership training. The state did really great with providing patient care training, but when it came to EMS leadership, that was very lacking. Some things that we also noticed was a lot of the directors typically were directors that had been there the longest, and that's how they were promoted to being director, or if the best patient care provider. So they typically didn't have a lot of training in EMS leadership, but they were the best fit for that person at that time. So a lot of them typically were handed the keys and said, here you are, go lead by best you can. And then sometimes a lot of them had physical court meetings or city council meetings that they were told that they needed to turn a budget into 2 days later. So we noticed that a lack of training. So we wanted to kind of focus a little bit on that and help these rural services out. As well, we noticed that funding is an issue with some of the small rural services. Some of the directors were actually on the truck trying to run a service plus run a truck as well. So we know that they had limited resources, and we wanted to kind of fill that gap with that resource. So when we started sitting down while we were sitting at home because of the pandemic, we was trying to figure out what we could do to help with that. So that's when we started thinking about EMS leadership and creating what we call an EMS Leadership Academy. We knew that we couldn't do this by ourselves, that we needed additional help. So that's kind of when we partnered with the Kentucky Board of EMS Services through the state. And also we brought on another partner that was the Kentucky Ambulance Provider Association, the state organization. So we brought those two organizations in to help us out with this. We felt that it was best needed to be able to bring in some resources that I couldn't provide, or the office couldn't provide. So just to kind of break down a little bit on what the program is about, we kind of identified what we thought was key areas that we wanted to focus on some areas that EMS directors needed some sessions in, some lessons. And we went out and searched the nation for some of the best speakers. Some of the topics that we got involved with was what is leadership? Also, some EMS law that we wanted to bring into that, some culture, EMS culture and operations training, as well as conflict resolution, and of course some budget. We know that a lot of these directors have very little education, some just high school diplomas, some small associate degrees. So a lot of the training that they had is all geared towards the medical and not necessarily on the leadership and operational. So that's kind of, we wanted to steer towards those a little bit. Is kind of where we got to. This slide right here just kind of breaks down exactly what our reach is. Currently, we've touched 20 different counties out of the 120 counties in Kentucky. A lot of them are rural counties. We do, though, understand that to fill the seats sometimes that we do want to offer those to the urban areas. But one thing that we have noticed is a lot of people that work in urban areas live in rural areas. So if we felt that if we could help some of the urban areas, that when the rural areas needed a director, they would have that ability to reach out to somebody from their area that definitely would have some of the training and knowledge and could fill that seat better. So that's kind of where we're at with the coverage area of Kentucky. Like Nicole said, we've been at this since 2020. We just wrapped up our second year. So it's kind of small yet, but eventually this, as we continue, this will still grow. So like we said, the first year we started during the pandemic. So everything that we did was online, very virtual. We typically, how we set up our program was we did 4 webinar sessions, one each it was a total of 8 months. Every other month, they would do a webinar. In between the webinar, we did what we called a one-on-one session. We worked, and that's where our partners came in with the Ambulance Association and the state EMS board. We got volunteers throughout the state to be mentors for our participants. So each mentor had 2 participants. So that gave them an opportunity to then have a conversation. So what we did was at the end of each webinar, we would give them an assignment to go back to their service and work on within their service to kind of start thinking about how they could develop their service, how they could develop themselves and becoming better leaders. So they did that every month. And then after that, they were completed the program. Now, the second year was a little bit different. We did get a little bit more in person, a little hybrid. We still do an introduction webinar. The mentor sessions with their mentors were still, the one-on-ones were still on a Zoom platform based. We did 2 sessions per day. We bring in the 2 speakers, and then they had a small little period, and then they came back for the second day. They did, again, like I said, we would give them during the 2 sessions, we'd give them a little assignment afterwards to take back and bring back to their mentors to kind of have that conversation and worked with. Some other things that we did do a little bit, we did some team building activities with their mentors. So they would take their mentors and them and a little bit of competition, but also it helped them think and work as a team and learn to communicate amongst other people. So that was something that we did add differently from the first year into the second year. So a little bit on how we selected our applicants. We only have 12 seats for this program. We keep it small, so that way the participants could have learn from the speakers and be able to ask questions. They feel more open, more willing to ask questions versus sitting in a large group of people. They tend to, when you do that, you tend to not ask questions or hope somebody else might ask the question for you. But being in a small group allowed for the participation of the group to flow a lot better. The speakers enjoyed it as well, so that gave them an opportunity to not necessarily have a set lesson, but it based off of the questions that they were able to guide their lessons a little bit and then to it differently based off of the different people, the different participants in their region that they cover, plus then also their individuality. So we take 12 participants. The first 2 years, we've had a little over 50 applicants. And the state, we divided into 6 regions, and we picked 2 participants for each region. Typically, they were anywhere between 5 to 10 applicants per region. So that's kind of where we're at with how we do that. We would grade the applicants based off an application that they had to fill out. They'd ask a few questions. We'd ask them a few questions on why they wanted to be into the leadership program, what they would bring out of it, and also ask how long they've been in the position that they are, what their goals are in life as well. Our first year, we had 11 participants completed the program. This past year, we had 10. So we're on a pretty good percentage rate on actually completing the program, considering it's anywhere between 7 to 8 months is where we're standing at right now. So just a little bit on the feedback. Some of the participants at the end of the program, we do the survey, so that way we can gather some information on how the speakers were, if we felt that the speakers are the right leading in the right direction that the participants needed in. So we were able to grade them and also get some feedback on how anything that the speakers presented on and that the participants were able to implement into their service or help implement into their service. Because some of these speakers are lower level assistant directors, shift supervisor type people. One example is the excellent program for young and old leaders in EMS. And that's something that we've kind of learned from our mentors. Even though these are mentors, some of these people have been around for 40 plus years, been EMS directors for 20 plus years. They even learned from it. They learned from the younger people, and they got to see a different aspect, and different view, take away from the program and how to run a service. So that helped them as well. So everybody that was involved is learning. Another one is the Academy is something that all directors need to take advantage of. So what's next? During the year, even while I'm doing, I did the second year, I was already planning on things to do for the next year. Some things that I do is I go out and attend leadership training, EMS leadership training throughout the nation. Also participate in different EMS state office rural health EMS programs. There's a few states out there that do participate in EMS leadership, and that's kind of how me and Andrea got connected. I also highly recommend connecting with other states because you can learn a lot of different things. Me and Andrea's had a pretty good bond that we've made over the last 2 years on talking about different things that we're working on in our state, plus than what they are, and able to compare notes. So that's helped us a lot, and it's helped me develop my program next. Some things that I'm wanting to do with our program is to implement some research projects, presenting, having the participants present to their other participants, so that way they get that concept on presenting, because we know that a lot of times that they have to present to the physical courts, city councils, mayors, and different things like that. So that way it gives them that opportunity to learn that aspect. So that's kind of where we're at right now. We're always out there learning, just trying to figure out what we can do. And I think that's about all I have currently for mine. I'm going to go ahead and let Andrea jump in there and talk about Michigan.
Good afternoon, everybody. And just get my slides up. Thank you, Scott. Thanks for the introduction. So Nicole really covered it all in her intro. So not much to say about me, but I am the EMS programs manager with the Michigan Center for Rural Health. And I'm going to be discussing what we're doing over in Michigan when it comes to leadership training and development. So the first thing that I wanted to talk about with you is why we decided to do this. And my disclaimer is, far before I joined the office was progressive and innovative enough to be doing these since 2005. And then when I did join the office, I actually attended my first EMS leadership training. I really hadn't had any formal education around training during my career. And when I attended my first course, it completely changed the way I thought. I would go as far as to say it was life-changing in a lot of ways. So once I was exposed to this, having had all of the experiences that I'd had in EMS, I realized its importance and the gap that was missing within our industry when it came to preparing people to lead. So why invest? So this is just a little bit of my thoughts on why EMS leadership training and education is so important. Those of you that know John C. Maxwell, he's written an incredible amount of books. He has a great podcast, and he teaches leadership education and training. So with strong leadership, it directly affects your retention rates. People always want to work for a good manager, good boss. It definitely affects revenue. It definitely affects your key performance indicators and measures. your metrics, and your operational and clinical quality. So a lot of things within the agency really, they fall on strong leadership. So it's really important that as we are starting to progress in our career and as we start to age out, we have a great succession plan. And I think part of that succession plan for EMS is bringing up the next generation of leaders early and offering this education earlier rather than later, so we can better prepare folks to succeed in roles, so they stay in those roles, and then we get to keep that wealth of knowledge and experience within our industry. So what are some of the challenges facing rural EMS? Well, this alone could definitely be an entire hour, right? But the reason I wanted to bring this topic up is it directly affects, at least I've noticed, who can and cannot attend our Leadership Academy. As you'll see, our academy is an 8-day commitment. There's homework in between, so they meet for 4 days, then they go back to their workplaces. We're usually apart for 3 to 4 months. They have books and homework and assessments to do. And then when they return, we go over those things, and they have 4 more days of education. What I've noticed is, the challenges facing rural EMS agencies are things like geography, distance, that directly affect payment models and reimbursement. We've got a major staffing crisis, but there's research to support that the rural communities actually have it worse, just because the pay and the population is lower. So there are a lot of challenges for our rural EMS agencies, those that are hybrid or are fully volunteer. Sometimes we have 2 or 3 people that are staffing those trucks 24/7. And oftentimes these folks will enroll in our academy, and then I will get communication about them not being able to attend because they just don't feel okay leaving their rural EMS service without coverage. And so this to me is kind of a pain point that I think we could keep in mind as we move forward, how we can reach these folks. Virtual training is a good option, and our offices and many of the other offices have tried to create some virtual leadership training. I will say it's not quite the same as when you get a group of folks together and you network and you create bonds. We do a really good job of creating a venue where, like we'll hold a mixer after we have our class one day to get everybody together. This year we played volleyball, we had cornhole outside, and we had a really good time together, and we really bonded with each other. You're not going to get that in that virtual education and training necessarily. So there's some ups and then some downsides, but keeping in mind that the challenges facing rural EMS agencies may be preventing them from being able to do this professional development, and what can we do to mitigate some of that so they can get into these trainings and get this education that I think is extremely valuable. So we actually implemented the training. This is a typo. It was not 2011. It is 2005. So we began offering these courses a long time ago. We've been a long time partner with Safe Tech Solutions. They do a really good job with the academy. We fund it through the Flex grant, and obviously our audience is rural EMS leaders. We do create a wait list for suburban and urban folks. So if for some reason we don't completely fill with rural service leaders, we will allow an occasional suburban or urban person into the academy. We are maxed at 26 students. This year we had total applicants of 44, and we had to vet those applicants through looking at whether they were rural. So rural took precedence, what their role was within their agency, and whether they were managing people. And then we also capped it at 2 people per service. We didn't want to have the academy heavily skewed towards one service or another, so we maxed it at two folks. So we did fill this year. We've been filling pretty much every year, with the exception of a last minute drop that happens occasionally. We do have a great graduation rate as well. The folks that don't finish the academy, we often find it's usually due to like a medical issue. Sometimes it's, they've moved out of state, life changes, things like that. Otherwise, everybody completes and graduates, and then they join our network, which I'll talk about in a minute. So what's the academy structure like? It's a 60-hour, 2-part education program. And as I said, 4 days, then a couple months off, and then 4 days again. Those 4 days are together in person. And this is an example of, what session 1 and 2 show when it comes to what Safe Tech offers. To get a little bit more specific on content, they cover things like leading up, the power of influence, power in politics, storytelling, leading your financial future, those types of topics. So you get a really good mix of different content. It's very engaging. It's very participatory. We do a lot of group work, so you're not sitting through death by PowerPoint. And then at the end of the academy, they graduate and they do get a certificate of completion. We've done a really great job as an office of creating a robust amount of continuing ed, or what we call CEUs, for the providers. And in our state, our instructor coordinator license is a license. So you have to get continuing eds for those as well. So this year, we've rolled out the most robust CEUs. So when they complete the academy, they get 18 CEUs and an additional 5 IC credits for attending. And this contributes to their ability to relicense as a provider and also as an instructor coordinator. So what happens after we graduate? Well, as I said, people are really engaged in this content. And when it's over, oftentimes, we're sad. We want to stick together. We've developed great relationships. So often what's occurred is, like, the students will create their own Facebook pages and invite us in. But what we've done as an office is we continue the learning. So we're really big on, you need to sharpen your saw your entire career, right? You need to continue your professional development. So we have graduate events. I will say COVID definitely negatively impacted that. So we will likely have our first graduate event this year, which we're in the planning phases for. So every graduate from the EMS Leadership Academy gets invited. We create a venue space for them, and we get everybody together, and then we do continued learning. And then we started Leadership Morning Coffee. So each graduate gets pulled into this listserv group, and they are invited to Leadership Morning Coffee. We have one session each quarter. It's typically run by me. I do invite Safe Tech in. Sometimes Safe Tech's able to attend, other times not. But leadership is my wheelhouse. So we will sharpen our saw together. It's a safe space. We do not record the sessions, and it's agreed that whatever we want to talk about within the session doesn't go anywhere. So if someone's having an internal issue that they need advice on and they feel comfortable, they will ask for advice. This is also a great place for people to get resources. So they will, come into Leadership Morning Coffee, and, for example, I'm looking for a social media policy. We don't have one that I'm happy with. Can anybody in the group share that? And then someone in the group will share, and we will be exchanging resources that way. We also created a private LinkedIn group. As a graduate, you get invited in. We try to keep up on that by posting major events, leadership articles, content, etc. And then, just continuing the learning process. So oftentimes what I'll do is carve out 3 to 4 of our webinars each year where I will teach a leadership concept. You'll get CEUs for it, and that is continued learning. And then we continue to roll out programming through the office that is connected to leadership. Sometimes it's wellness, sometimes it's a subtopic, but always connecting back to sharpening the saw and professional development. So with this programming, we've definitely strengthened our partnerships with other rural EMS agencies. Engagement goes up. We form those networks and those bonds with folks and keep in touch. Our medical control authorities are well engaged. Oftentimes we have those leaders wanting to get into the academy and attend. Our Michigan Association of Ambulance Services is engaged in this. Our Bureau of EMS and Trauma is also very much so engaged. Northern Michigan Center for Rural Health, which is located in our Upper Peninsula, is part of this planning and engagement. And our critical access hospitals love this as well, because many of them own their own ambulance services. So we've engaged them as well. So what do the graduates have to say? Well, it's no surprise that the graduates are extremely happy with the programming. It's just constantly a positive experience. I mean, I could have probably, continued to fill slides with some of the recommendations and testimonies that the students had. So pass rate's really good, and everybody's really happy at the end of the academy. And this is my contact info. If there's any questions I can answer about our programming or anything I can share, please don't hesitate to reach out to me. And that is the end of my presentation.
Thank you, Scott and Andrea, both. Anybody have questions for Scott and or Andrea about their leadership programs? We have lots of time left. We've got at least 10 minutes or even 15. If you guys want to ask them some questions, feel free to turn your webcams on. I see one person unmuted. I'm hoping Penny has a question. Don't hear you, Penny. I don't hear you. It looks like you're unmuted, but I don't hear you.
Yeah, I don't hear her either.
I'll jump in. I have a question. One of the problems, folks, first of all, great presentation. I love leadership, and the association between good leadership and good ambulance services is just so obvious. But what we see is really a dramatic turnover in terms of hospital leadership. Are you finding that as well with ambulance leadership? Does it tend to turn over frequently, causing a need for more frequent leadership education?
Yeah, personally myself, I see quite a bit of that in the more rural areas, because typically they get promoted to director close to the end of their, especially if it's a service that provides retirement. So they typically get those people that's got 4 or 5 years left. They put in their 4 or 5 years and they're out the door. It boosts their salary cap for that retirement. But yeah, I mean, even in some of the younger ones, I think a lot of it is they see exactly what they're faced with, especially with the shortage of staffing, and then having to deal with politics in some of our services, unfortunately, that drives them out, and they move on and decide that they just rather be a paramedic or EMT and go back to just being on the street. So yeah, I can see that in Kentucky.
Yeah, and Terry, I can also echo that, but I would say more in the middle manager arena. I've seen lots and lots of turnover, not so much, like our executive directors, and echoing Scott's point, a lot of the larger suburban urban services, maybe a little bit less, but the middle manager turnover is just incredible. And I noticed it worsened during COVID quite a bit. And it was shocking how many people just said they either left or they said, you know what, I just want to go back to turning calls. I don't want to do this anymore.
Thanks, guys.
Can you hear me now?
Yeah,
can,
there you
Penny.
are.
So also thank you. Great presentations. We also in Wisconsin have a leadership or more management training. But my question is, what kind of evaluation other than satisfaction that you guys might have been doing to see, is it actually changing practices within the organizations? Or Andrea, you had mentioned at the beginning some really great relationships between revenue and some other things that you said. So I'm just curious what kind of evaluation you guys might have been doing or might be planning to do with both of your academies.
So Scott, I'll start with this one, if you don't mind. I didn't get a chance to confirm. I'm just going to keep talking. So Penny, we actually use the Wisconsin Office of Rural Health assessment that you guys developed a few years ago. We actually hand that out at the beginning and the end of the academy. That's something we use to gauge, any progression that they might have. And then what I did also, which you're reminding me, I really should have shared some of these results because we do have them. But we do the typical evaluation, but then what I did was I developed some more robust questions for the attendees as well around, like what was the missing link for you within the content? What would you like to see in the future? Was this your first leadership and education training experience, to see who we had that had never had leadership training? So questions like that I built into our evaluation. So each year they get that. Thank you. The attributes of successful ambulance service. That had the title left my mind. So thank you for that, Nicole. And then, we keep those evaluations. They do those at the end of the academy. So that's what we do for an evaluation.
And I'll just add, currently, I mean, we're in that phase is that we're trying to learn what we need to capture. We're typically just getting that. How was the program? Was you able to utilize anything that you've learned from this program, and how did you implement it into your service? And then just kind of a gauge on how they ranked the different speakers on how they felt were important to them. We know because every speaker is going to be different. Every person is going to be different. And one thing that we've noticed between the two is even the groups, individual different year groups evaluate the things differently as well, even though it's the same speaker, same topic that we had these first 2 years. So that's something that we're looking at. And I sat in on Wisconsin's training as well earlier this spring. And so that's kind of the stuff I'm looking for to try to help build our system to better Kentucky. I
would just encourage everybody to check out the link in the chat to the Wisconsin office tool, the attributes of a successful rural ambulance. Andrea mentioned the assessment portion of it, but there's also a workbook that goes along with that, which is just really that next step to the assessment. Find out where you're at in the different steps, and then figure out how you move from a 1 to a 2 or a 2 to a 3 in any of the attributes. So check that out. It is a fantastic resource.
And to be clear, I wasn't fishing. I forgot Michigan was using that assessment tool, but that was great.
Yeah.
Thank you both.
It's a good question. Thank you.
There are actually a bunch of states that use that in different ways. They'll use it as Andrea talked about it. Some of them are using it to assess need when it comes to the community level needs assessment that is required as part of the EMS program area. You either need to do community level assessment or you need to do statewide assessment. So that I've heard commonly used as one way of assessing community level. Leslie, did you? No, just peeking in. Cool. Anybody else have a question? Go ahead, Kate.
Does it seem like there's been any one topic area that's been most helpful for people who participate? I know you guys mentioned lots of different like budgeting and conflict resolution. Any one area that seems kind of lacking across the board that you found, or it's all totally different?
I can go first. One thing, that's one thing I've noticed in the evaluations. It's different from year to year. I think it just generates on the level of provider, if it's lower level versus executive level. So we just try to point out what we can. I think we're taking a shotgun approach and just trying to hit what we can hit when we come to training. But I'm at that stage where I'm going to add more. We're going to keep what we've got, and our next year we're going to add some more sessions and different topics that I've gathered from other programs to try to help fill those gaps. One thing that we do is like an evaluation is something that they felt that wasn't taught during the program that they think that needs to be. So we use some of that as well to try to pull in some more topics and conversations that we might have missed or didn't think about.
Yeah, and to add to Scott, I think wellness is a missing component. And I have no trouble inserting myself. So I did tell Safe Tech that I would like to teach wellness with them when they come to Michigan. And so in September, I will be inserting myself into their program, which they had invited me in to do that. But I will be bringing that through the center because I think that is a missing component, is trying to teach people, you have to live well, to lead well. And if you're not sleeping, if you're not, taking care of yourself, if you're not eating the right foods, all of those things impact how you perform. So we're going to be bringing that in. We did see that as a need in our evaluations. But as Scott said, it is really different, I think, for everybody. And we do get mixed responses depending on what your weak spot is as a leader. So I've also noticed that as well.
We used John Becknell of Safe Tech Solutions to do a webinar on resilient EMS workforce not too long ago. So I'll drop a link to that in the chat in case any of you want to learn a little bit more about that. And then obviously you could talk to Andrea for more information about that.
Yeah, John's great. Very talented.
Mm-hmm. Other questions? I have one. If we don't have any other questions, I have one. So one thing that others might find interesting is just kind of what the flex investment, the monetary flex investment is for this training. What does it cost? What would a flex program be investing money-wise if they were to fund an initiative like this?
My first year, I think I did on $500.
What?
Truthfully, I didn't have a lot of money. A lot of people helped just pretty much volunteered their time to put on our first one. One thing they did say though is if you do this again, we'll want a piece of the pie. But yeah, I mean, it's not near as much money as what you think. I mean, it does cost a little bit of money to bring in speakers. But I mean, you could easily put on a really good program for 10,000 or less. I mean, that's kind of the budget that I'm working off of is about 10,000. That's paying for everything that I do within this program. And you can tell we're doing a lot with very little money. So, I mean, it for us, we're not putting out as much money.
Yeah. And for us, I can't disclose exactly what we spend just out of respect for who we work with.
Sure.
But I will echo the point that, you could spend anywhere from $10,000 to $50,000, depending on what you're doing and who's speaking. The robustness, all of that it will affect the programming. So yeah, I would give it that range. And as Scott highlighted, you could do it for under 10. So he successfully did that.
Thanks. Anybody else? Terry, any parting thoughts?
Well, I have a question, and it's not necessarily about leadership, but it certainly has aspects of leadership here. Nicole and I have been really closely monitoring the growth of community paramedicine. And I'm just wondering what is happening in Michigan and Kentucky. Do you see an interest? Do you see a growth there? So that'd be my final question.
I'll let you go first.
Okay. So I can answer that from both sides of the coin. I currently work in a role that is an innovation coordinator role. So one of my tasks is to develop a CP-MIH program. And that's been really eye-opening to me when it comes to the lack of payment structure that's available. I am still doing research, but I will say the smaller services, I think there is interest in the conversations that I have in any of the roles I play within the industry, but there's hesitation because of the structure of the payment model. So I think that's the biggest challenge. If we can get payers on board, I know we have some huge advocates in our industry right now that are working towards that. If we can get that figured out, I think that CP and MIH will expand. And I think it is a huge, it's a healthcare gap that I think we could definitely fill. I hope that answers that question.
Yes, thank you.
And I'll say the same thing. I'm wearing two hats in that kind of situation, actually probably three, because from the state office, I'm also on the state EMS boards, committee for community paramedicine, and the local service that I work at, also trying to help implement a community paramedicine program in mental health as well. So, I mean, reimbursement is going to be the primary focus to be able to keep these things funded and sustainable. Until you can get that, I don't think there's going to be a big push for it unless you have some partner, some hospital that's willing to see the advantage of creating the resource and the availability and also then the flexibility, because community paramedicine paramedicine has such a broad worker scope that they're able to do, and that they're able to fill the gaps in a lot of the communities where there might be lacking different things. And the service that I'm working at is that mental health piece, and that's kind of what we're trying to help fill that gap in.
Thank you.
So 2 things. We have a guide that we put out last year, implementing and sustaining rural community paramedicine, based off of a stakeholder summit that Terry and I held. I think that was earlier last year, early 2021. So that link I just put in the chat is a link to that. You can check that out. There are some key initiatives and suggestions from people who have been there. And I think the sustaining part of it is really the important part. So check that out. And that is all the time we have for this session. So we are adjourning for a break now until 2:30 p.m. Central Time, so 15 minutes from now. After that break, join us for a presentation and discussion on the updated Flex program core competencies. And you can find a link to that session in the attendee hub. And that's it. Thanks everybody for joining us today. Good discussion.
Thank you. Thanks for having us.
Yeah,
Thanks, guys.